depression and anxiety, if you put it together, affect about 50% of people at some point in their life to the level that it would indicate having treatment or some sort of intervention to help, either psychotherapy, medication, group therapy, some sort of counseling.
It's going to be interesting to see, too, what the after of COVID is going to do to depression. Because you're right, no matter what age group you're at, depression is one of the biggest causes for suicide attempts and suicide, no matter what age group you're in. Mm-hmm. So it's a very key one to watch for.
So the depression piece is a significant factor with suicidality and is often associated with suicidality. So it's important for people to also understand signs and symptoms of depression, either themselves or their children or loved ones, to kind of track that, because oftentimes escalating depression symptoms can come before suicidal ideation. Some of those symptoms are change in appetite, an obvious one, crying spells, but if you notice someone crying more than usual at home, it's worth investigating, looking into. Change in sleep, staying up all night or wanting to sleep all day, one or the other, weight loss or weight gain. Those all can be indicators of an ongoing depression that might not have an emotional component yet, but the body or the brain changes are already happening. That's when it's time to look into getting some help. You can start with a primary care doctor, a school nurse, just to sort of look into that a little bit more. But those can be significant predictors of ongoing serious depression, which can lead to suicide.
So if you notice it, you need to first talk to the person about what you're seeing. If you're not satisfied with that answer, then it's the time to reach out to your primary care doctor, the pediatrician, the school psychologist. There's some things I'm concerned about. I've talked to them, and I'm taking action, as we talked about. That's the key to this whole deal. Learning some of the things that could help you more easily recognize some of these signs, but then to take action.